51. How should oral suspensions be stored? The answer is oral suspensions should be stored in the refrigerator when it is dark and cool. 52. What are the symptoms of superinfection that the PT teaches the client to report to the PHCP? The answer is the symptoms of superinfection that the PsyTech teaches the client to report to the PHCP are fever, abdominal cramps, diarrhea, rectal bleeding, lesions in the mouth, and anal or vaginal itching. 53. What is the classification for tetracyclines in terms of spectrum? The answer is the classification for tetracyclines in terms of spectrum are broad spectrum. It works on many pathogens. 54. Which antibiotic is commonly ordered when the patient is allergic to penicillin? The answer is the antibiotic that is commonly ordered when the patient is allergic to penicillin is tetracyclines. 55. What is the reason that tetracycline is contraindicated during pregnancy, lactation and early childhood? The answer is the reason that tetracycline is contraindicated during pregnancy, lactation and early childhood is for pregnancy. There is a possibility of toxic effects to the developing fetus, and during childhood children can develop permanent teeth discoloration, like yellow, gray, and brown teeth. 56. What instructions should you give to the client receiving tetracycline regarding food restrictions? The answer is the instructions you should give to the client receiving tetracycline are: do not take with milk, cheese or products with calcium, iron, and antacids impairs absorption. 57. How should erythromycin be administered with regards to intake of food, AC or PC? The answer is erythromycin can be administered with food to prevent GI distress. 58. What are some interventions for diarrhea? The answer is some interventions for diarrhea are: inspect stools for blood or mucus and collect stool samples. Record I and O. Check skin turgor for dehydration. A decrease in skin turgor is a late sign for dehydration. Encourage fluids plus electrolytes. 59. What is included in patient teaching to minimize photosensitivity? The answer is what is included in patient teaching to minimize photosensitivity is: avoid exposure to direct sunlight, cover arms and legs with clothing, like covering with long sleeves, and wear a wide-brimmed hat to protect face and neck, and use sunscreen SPF 60. What drug is given orally which is commonly used in the long-term treatment of acne? The answer is the drug that is given orally which is commonly used in the long-term treatment of acne is doxycycline.